welcome to Points of View, a discussion of issues regarding persons with disabilities, moderated by Doug Usiak.
Today's panelists are David Edgerton, Outreach Coordinator for Money Follows the Person; Todd Vaarwerk, Director of Public Policy, Western New York Independent Living Incorporated; and Melissa Golpl, Outreach Specialist for Money Follows the Person.
Welcome. Lately we've been hearing a lot about the cost of individuals who are on public sponsored programs like Medicaid, Medicare, and these people with disabilities versus the community-based supports versus nursing home supports or institutional care. And today we're going to talk about a program called Money Follows the Person. So which one of you want to explain what does Money Follow the Person mean?
Well, Money Follows the Person is the title of a program by the Department of Health to provide unbiased information and education to residents of nursing homes that desire to leave the nursing home.
So what does that actually mean, Money Follows the Person, Todd?
Well, what that means is that a portion of the money that would normally go towards their institutional care being much higher than community placement, would follow that individual as they move to the community to help defray some of the costs of being able to move them to the community.
So in other words, the government would give the individual the money, Melissa?
No, actually the way it looks, the money would actually be paid for through the service providers or in the form of vouchers for particular types of public assistance, or in the form of benefits. So the person doesn't actually get an account with a certain amount of money. It provides for the benefits to their medical services, so they would be covered. If they're eligible for one of the forms of waivers that Medicaid provides for, the providers of services actually get paid or reimbursed for those programs and services provided.
Including the housing providers.
Exactly.
And where would this money be coming from? What pot?
The federal part of the Medicaid match.
Would pay for the medical care, the housing care, and everything else?
Right, for a particular period of time.
And then what?
Well, then it is hoped that they've transitioned into other community-based supports by then. Money Follows the Person is a limited time activity to transition people into the community, to give them time to get onto the waiting lists for the appropriate supports.
So, Dave, what's the purpose of even having a program like this?
Well, to be very specific, our program is identification and outreach, education, coaching, helping people know what all the services that are available in the community so that they know, and it's based on their own self-identification of need. They tell us what it is they would need to live in the community. So we let them know as the experts that are called in about what services are available in the community, because we have to keep up with all of the services that open, close, how to contact them. We provide the linkage and the coaching. And they through their own self-assessment, they let us know what they need and we coach them in that.
Yeah, but that's getting into the program itself, but what's the value of having such a program? I mean, people are in nursing homes. They may want to be in that nursing home. They're being taken care of.
That's choice.
But that's not true, Doug. Every year the federal government requires nursing homes to ask all of their residents if they want to leave and come home. That information is recorded in something called the Federal Minimum Data Set. And we can find thousands of people who have said to the federal government through their nursing home provider, I don't want to be here, I want to go home.
Well, yeah, but if it's the public money and the public is providing a safe accommodation where they're warm and they've got food, Melissa, I mean, why take the next step?
Well, it sounds all well and good, but it's consumer choice. You hear us sometimes talk about the Olmstead decision. Back in '99, the Supreme Court decided that people that are in institutions who have disabilities, if they could safely transition back into the community, states are required to provide services in the community of their choosing. Now, we're just supporting consumer choice. When we go in and ask a question, would you like information about being in the community, or would you like to be back in the community? If they say no, we respect that, and we're finished with seeing that person. But based on the information that we've collected and based on the knowledge that we have about independent living services and the cost savings analysis that we've done, we found that, community care can be provided at sometimes 1/4 to 1/3 the cost that those same programs and services can be done in the nursing home. Doesn't that make good sense to try to move someone to a lower costing service, especially if it's their choosing? We support our consumers in their choice. We just have to figure out a way to help them.
And as a person with a disability, don't I have the right to be able to live a life that's beyond safe and comfortable? Don't I have
what's the responsibility of the taxpayer to provide you a safe place to live, or to give you the Cadillac?
Well, if you want me to break down the numbers, because I did the math before the show and I have it written down. For New York State nursing home, just for a bed, not including any other care, but just for a bed, is between $92,000 and $138,000 throughout the state. That's an equivalent for just a bed in the community of an $8,000 to a $12,000 apartment per month. So when you're comparing apples with apples, it costs a lot to keep someone in a nursing home.
Okay.
And that doesn't even count the health decline that people experience when they're institutionalized. People are healthier when they're in the community, when they're dealing with their relatives and participating in community activities that they like. They're healthier. They have a better reason to maintain their health. When they're in a nursing home, that's not the case.
How many individuals in a nursing home do you know hold a full-time job or even a part-time job, or are even allowed to go and participate in volunteer community activities of their choosing? I mean, we talk to people all the time that they lose the interest in their hobbies. They lose the interest in, attending family events because they're really not given an option to have access to participate. They're really cut off from the rest of the community by being in that facility. So we go in and we try to help individuals exercise, reconnecting to the community if that's what they choose.
And to bring it home, everybody watching this show, we're all, because like Todd said, for the disabled, well, we're all aging. And if we don't just drop dead while if we don't just drop dead while we're walking, we're all going to reach a certain place where we're going to need care. So having the right and the dignity to have the care where we want it, especially when it's cheaper to the taxpayer to have it in the community in your own home, to me that would be the logical choice for me, anyways.
And we'll take a break right here. When we get back, we'll talk about how can people get involved and benefit from such a program as Money Follows the Person. See you right after the message.
Today, people with disabilities are participating fully in the social and economic life of New York State. In large measure, this is true because of the work of an independent living center in your community. The New York State Independent Living Council is dedicated to promoting the independent living philosophy and to facilitating access to independent living services. For more information on the council or about your nearest independent living center, call toll-free 1-888-469-7452.
Are you looking for new ideas to help you sell? Need a presentation that must compel? Have a message you wish to dispel? Or an important story you need to tell? Are you exploring new ways to communicate, to motivate, to educate, or demonstrate? Or are you searching for creative concepts to help you entertain, promote your brand name, to effectively train, or launch a new web domain name? Then focus on Creative Concept Studios and see the possibilities.
Welcome back. We're talking about a program called Money Follows the Person that assists individuals out of institutional care. For those individuals that do find themselves in some type of institutional facility and being taken care of and have a disability, how do they know if they're eligible to be able to participate in this program?
Well, this program is based on just the desire to go into the community. So they can call our agency and tell the intake person that they are interested in getting out of a nursing home, and we would be the ones that would go out and see them and find out what it is their community-based needs would be, and talk to them about that at great length to make sure that they're, certain and feel secure.
They could speak to any service provider that works with them, including the nursing home, their independent living center, anybody. As soon as they make that reference that they want to leave, they're eligible to start working in the program.
Yeah, if somebody is in a nursing home or an institution, what should they think about to see if they should even pick up the phone and give you a call?
The first thing they should think about is, are they willing to pick up the phone and make the call? Or are they willing to talk to the social worker or the nursing staff or the discharge planner of the facility that they're at? Are they willing to do the work? Because what do they have a lot of? They have a lot of time. If they're not willing to, engage the people in the conversation about their desires, their wants, their needs, and if they're not going to think about it in a realistic fashion, one of the things that's usually discovered in the conversation that Dave or myself, when we're doing our outreach with the facility staff, one of the things that usually comes up is the person may believe that their needs are such that they could do it, but then when you look at all of the related medical needs or the assistive technology needs, the home modifications that would be required, especially for homeowners that have transitioned into the facility, it may not be realistic, or the amount of work that needs to be done may be overwhelming to the person, and they may not have a good idea of what they actually need in the community.
Let's make sure, though, that even if those needs are higher than what an MFP person might specify in the nursing home, we can still do that. Because a lot of times we find they'll say, well, I don't really need all that much, like Melissa's saying, and it turns out that medically it's a bit more involved. Getting them into the community by doing those home mods and getting that assistive technology put together and getting that home health component put together and things that they've never thought of. So my answer to that question is they need to be prepared to think outside the box and need to be honest with the money follows the person people about what their real needs really are. Because if you put all the needs out there, we're going to be able to find a way to get them met.
Other than choice, Dave, why would a person want to leave a nursing home or an institutional care?
Well, one of the basic things would be money. If they don't have insurance and they're being billed, they would want out.
Well, if they're in, they can't pay the bill. Wouldn't they be thrown out?
They could be. They could be put into a shelter. But like the other day, I was with a guy and he said he had a bill for a year, and the bill was for $143,000. He, of course, wanted out because that was a lot of money.
Sure.
Trying to think, what are some of the other things that we run across?
You might want out because you want to be able to choose what you eat and when you eat. You might want out because you want to be able to go to the church you choose to go to and not the one that the nursing home thinks it's expedient to transport you to.
Well, actually, they have a chaplain come in and do the services there, so you don't have an option.
Maybe you actually want to go to the church with your family and with your peers and your community members, and they won't let you go. These are things that happen in nursing homes and institutions all the time.
Or what if you want to go home because you realize you're at the very end stages of your life and you would like to spend those last days of your life in the setting of your choosing, not having to receive medical procedures against your will or things that you believe are not going to benefit you and your quality of life in your later days. How many of us want to, be at home with our family and loved ones when we're, nearing the end? When you're surrounded by strangers and medical staff, if you have the opportunity, wouldn't you want to be at home if you could?
Even the holidays coming up, Thanksgiving, Christmas, people want to be home.
What about the extra costs that are involved in community life? You're leaving the institution, picking up that rent subsidy, picking up the food costs, picking up the medical costs. Doesn't that sort of add up?
Yeah, but it doesn't reach anywhere near what the institutional cost is. Independent living centers estimate from the New York State nursing home average that living in the community can be 1/3 the cost of living in the institution. So even if you're picking up all those expenses, okay, you're still saving the taxpayers and Medicaid money.
And when you're in the nursing home, you get a $50 stipend if you're on Social Security.
Yeah, that's it. That's all.
And
they
that's
do.
all. That's all you get for your needs. They don't supply you soap. They don't supply you clothing. They don't supply you anything. So the $50 is what you get for that. A lot of people go without a phone, so they're not able to make any phone calls or call out because the $50 doesn't pay for the phone. And if they paid for the phone, they couldn't pay for anything else. So in the community, you're getting your full Social Security check or whatever else your income is, and you're able to pay for a lot of those things you're not even able to pay for in the nursing home.
The services that are provided by you through Money Follows the Person, if the individual is interested, gives you a call, or if your contact, I think somebody mentioned before that there's a New York State registry. How do these people actually end up on that registry?
The minimum data set and the nursing home survey shows the level of care a person needs, shows the health conditions they're in, asks them a lot of questions, like the minimum data set asks specifically, are you interested in living in the community? So based on those factors,
So in other words, everybody who initially comes into the nursing home is asked, do you want to get out?
Yes,
yeah,
that's
that's
part
the
of
way
the
it's supposed
assessment.
to be. Yeah, it's supposed to
Yep.
be part of the assessment. And nursing homes are supposed to call us to have us come in to talk to people that state at any time that they're interested in getting out. They're supposed to call us.
And we'll take a break here, and then when we get back, we'll get more into the actual program and what is being discussed in order to assist an individual out of the nursing home. So we'll see you right after this message.
Today, people with disabilities are participating fully in the social and economic life of New York State. In large measure, this is true because of the work of an independent living center in your community. The New York State Independent Living Council is dedicated to promoting the independent living philosophy and to facilitating access to independent living services. For more information on the council or about your nearest independent living center, call toll-free 1-888-469-7452.
Are you looking for new ideas to help you sell? Need a presentation that must compel? Have a message you wish to dispel? Or an important story you need to tell? Are you exploring new ways to communicate, to motivate, to educate, or demonstrate? Or are you searching for creative concepts to help you entertain, promote your brand name, to effectively train, or launch a new web domain name? Then focus on Creative Concept Studios and see the possibilities.
Welcome back. We're talking about Money Follows the Person for people with disabilities who find themselves in a nursing home. And right before we took a break, Dave, I had one more question. You're talking about the individual in the nursing home and that particular question being asked the moment they come in, do you want to get out? Why would a nursing home even offer you this information? I would assume most nursing homes are in the business for money.
Yes, they are. I mean, bottom line is what keeps them in business. But the Department of Health has put the question into a section of the minimum data set. The section is Section Q. And that series of questions is asked of the resident about moving back into the community. If it's affirmative that they want to move back into the community, we are supposed to be called. And that's a Department of Health thing.
Mm-hmm.
Well, and it also originated with the Centers for Medicare and Medicaid Services. I mean, we're in a tight fiscal climate these days. They're looking for, reductions in our federal budget. They're looking for reductions at the state budget level. Cost-cutting measures are being implemented across, all areas, all sectors, and healthcare is one of the high-cost areas that they're looking at. So this is part of this program, the minimum data set. The assessment is based on the criteria that the resident meets when they come into the facility, and if it's determined that they could actually benefit from a lesser level of care, that's what this survey is supposed to assess and identify.
Yeah, and to piggyback off that, if anybody wants us to come out and do a presentation, in that presentation is a video from the Centers for Medicare and Medicaid Services talking about Section Q and Money Follows the Person and the identification and outreach project that we do. So, you know, we could help people get a better understanding, be they in nursing homes or other agencies or even family members get a better understanding of what it is we
So
do.
you will go talk to family members as well?
Oh, yes. Many of the
Because-
people we run into, once they're in the facility and are quote unquote a resident, if the family might have known about some of these programs and services like home modifications or, you know, home care, home health care services, sometimes the resident might not have achieved that resident status, because if they were able to provide these things before the resident had a significant change in health status, and then it was determined by the social worker, whether at the hospital or the nursing home facility, that their home was inaccessible, if the family was able to access these programs and services prior to, some of these residents would never reach the resident status.
So when you sit down and actually talk to the person in the nursing home, what are you actually sharing with them? You know, outside of that nice little bureaucracy of some database and Section Q, Article 5, but you know, outside of that, what do you present to the individual for their consideration?
It's the independent living philosophy, Doug. We don't, you know, when we're working directly with the customers, we don't present anything. We come in and we say, look, you've identified you want to get out. Let's talk about what we need to have happen to get you out. And we talk about those issues that allow that person to be best successful in the community. It's not like we're giving them a movie saying, when you get out of the nursing home, this will happen.
So you go to an individual and you say you want to get out. What can that person expect that they need to do in order to get out?
Well, they can expect a lot of work. Actually, Todd is partially correct in this. Partially. When Dave and I go to visit a resident in a facility, or we go talk to a social worker or a family member, we actually take with us a case that has every identified resource in the surrounding community that the person could potentially either benefit from or try to access as a community support and service. Some of them are private pay services. Some of them are the publicly funded ones, like the Medicaid waivers, which there are several different kinds. Some of them can provide home modifications, some of them don't. We actually have what's considered an informal interview. We have, consistent with independent living philosophy, a conversation with the resident, because during that conversation, we learn about them, we learn about the resources already available to them, we learn about their network, their family, the community that they come from, their wants, their desires, and we also uncover maybe some hidden needs that they're not aware of. When I talked earlier about, you know, the nursing home may have the medical documentation that shows they have a high level of care need, which means we have to provide information to that resident about those options in the community so they can potentially access them. There's a lot of information, but every time we meet with a resident, the information provided is different. It's done on an individualized basis. We'll end up leaving them with a packet of information, and that's what will get the ball rolling.
Right.
But they have to make the commitment to make the phone calls and do the follow-up with the social worker. The burden really is on the resident.
They have full coaching as to where to go from there once we leave. They also, in my case, I tell them they can call me if they run into any obstacles or confusion. They can call me and ask me questions that I can coach them. Another thing too, something Todd said earlier about telling the truth about what your needs are, and I tell this to people across the board throughout my job, is you have to drop the pride. Pride always stands in the way of what we need, be it you or I, Doug. I mean, you know, if you're not being willing to be honest with yourself, you're not going to go anywhere. So you have to be really honest about what your needs are. To tell me you don't need something you do need is to set yourself up to fall on your face once you're in the community.
So how does somebody get in touch with a Money Follows the Person agency?
Well, the local contact agencies are listed on the Department of Health website. They can also call their local independent living center, because in New York State, the Money Follows the Person demonstration project for education and outreach are the network of independent living centers.
And outside of you folks that are working on this project specifically, I mean, it does sound like there's a lot of possible bureaucracy that needs to be weeded through. Is there help for the residents to navigate those systems?
Well, that's what general independent living services are for. You know, the money follows the person is an important tool to start that ball rolling, but an independent living advocate can be that person that helps step in when the obstacles are found. Again, we're not going to do it for you, we're going to do it with you, but it's going to be based on the idea that if you can't do it, for example, if you're in a nursing home and you can't leave to drop off an application at a housing provider, that's the kind of thing that an independent living specialist can do.
Okay, and on that note, that actually we're out of time, and I want to thank you for that. And if you're a person with a disability, or if you have a family member and you find yourself and know this person's in an institution, a nursing home, wants to get out, contact your local Money Follows the Person program. And good luck. Thanks for watching. We'll see you at the next show.
Points of View is presented by the New York State Independent Living Council, Incorporated, in cooperation with the Catskill Center for Independence, Finger Lakes Independence Center, Independent Living of Niagara County, and Western New York Independent Living. For the location of the Independent Living Center in your area, call toll-free 1-888-469-7452.